For decades, the idea of a real emergency medical system in Burkina Faso felt like an impossible dream. Every time it was brought up, people rolled their eyes or laughed it off. SAMU? That old promise? It's been almost 30 years. It'll never happen here, they'd say. It wasn't just skepticism. It was deep disappointment. People had given up believing it would ever come true. The reasons were always the same. No money, too much red tape, bad roads, too many remote villages, and constant insecurity in the north. It seemed like one of those grand ideas that only looked good on paper but couldn't survive reality. But today, something extraordinary has happened. That dream, the one everyone had given up on, has become real. Not only was the SAMU emergency service finally launched, but it was launched in a big way. At the handover ceremony at the Martyrs Monument in Ouagadougou, 15 mobile clinics and 36 vehicles, including refrigerated trucks and pickups, were unveiled. But this wasn't just another event. It was a message, a statement, a loud declaration to the world. In Burkina Faso, under this leadership, access to emergency health care is not just a goal, it's a right. It's a part of who we are now. And surprisingly, the world is listening. Even Bill Gates, one of the world's biggest names in global health and development, stood up and paid attention. Instead of praising the usual big players like Nigeria or Ghana, Gates pointed to Burkina Faso, Mali, and Niger. They are showing the world what's possible, he said. He talked about how these countries are achieving results once thought impossible, lowering infant deaths, creating real community health programs, and building systems that actually work. He wasn't just impressed, he was inspired. At the heart of this transformation is someone who dared to lead differently, Captain Ibrahim Traoré. When he became the leader of Burkina Faso, he faced a crumbling health system. Clinics were falling apart. Rural communities had no access to basic care. The whole system was being held together by foreign NGOs with their own goals and timelines. Diseases like malaria and cholera were everywhere, and the country was stuck in a cycle of political instability. But Traoré didn't just try to fix the old system. He decided to build a new one from the ground up. His first move was bold. He took control of the health system, reducing foreign interference and pushing for national ownership. He trained more local doctors and nurses, and he treated healthcare not as a luxury or charity, but as a duty of the state. He didn't see healthcare as something to be handed out when times were good. He saw it as part of Burkina Faso's independence, a core part of sovereignty. But Traoré didn't stop at policy. He went to the people. He understood that you can't fix a broken system from a comfortable office in the capital. So he sent trained health workers to the villages. He partnered with traditional healers instead of pushing them aside. He made sure clinics were designed for real people, using local materials and powered by solar energy. I met Awa, a midwife in the remote village of Zainar. 3 years ago, she worked in darkness, with no clean water or tools. Today, she delivers babies with power from solar panels, keeps vaccines cold with solar fridges, and calls emergency specialists when needed. Her story is not an exception anymore. It's the new standard in Traoré's Burkina Faso. Gates praised this smart approach. Instead of copying Western models, Burkina Faso created its own. It combined African engineers, traditional knowledge, and local planning to build clinics that work, even in hard-to-reach areas. While other countries are stuck waiting for foreign aid, Burkina Faso chose a different path. Build what you need with what you have. Own your future. And it's working. But perhaps Traoré's most daring decision was this. He took a portion of the military budget and invested it in healthcare. In a country facing terrorism and insurgency, that seemed risky. Critics warned it would backfire, but he believed that real security starts with healthy people. Instead of just building more checkpoints, he created trauma centers staffed by both health workers and soldiers. These centers became safe places for families and communities. Again, Gates praised this move. He compared it to countries like Nigeria. wealthy, powerful, but with one of the worst maternal mortality rates in the world. In Nigeria, nearly 1 in 100 women die giving birth. In contrast, in the northern town of Ouagadougou, Burkina Faso, birth complications dropped by 30% in just 2 years. Why? Because of the emergency response system built by Traoré. During the COVID-19 pandemic, while rich nations scrambled, Burkina Faso stayed calm and organized. Traoré invested early in vaccine education, trained health workers, and built cold storage networks. He even partnered with local biotech companies to explore packaging vaccines inside Africa. So when vaccines arrived, Burkina Faso was ready. Rural communities were vaccinated faster than anyone expected, death rates dropped, and public trust in the health system soared. Traoré didn't do this for fame. He did it to protect his people. He made sure data teams tracked vaccine reactions in real time. He made it clear Burkina Faso would never again be at the back of the line. But one of the most powerful things Traoré did was put women and youth at the center of everything. He didn't just give them a voice, he gave them power. He passed laws to guarantee women leadership roles in health. He funded scholarships for young women to become nurses, public health experts, and medical technicians. In cities like Bobo Dioulasso, young people are now creating health tech startups with government support. They're building AI tools that work in local languages and run without fast internet. These aren't foreign inventions. They're local solutions for African problems. Meanwhile, in Nigeria, youth unemployment is rising, and trained health workers are leaving for jobs abroad. Burkina Faso is doing the opposite, training and keeping its talent. Traoré's bet on youth and women isn't just progressive, it's smart. A health system that reflects the people it serves will always be stronger. When Bill Gates praised Burkina Faso, Mali, and Niger, he wasn't just being nice. He was sending a message. He was asking a serious question. If these small, struggling countries can make healthcare work, why can't the wealthier ones? The answer isn't about money. It's about leadership, commitment, and the courage to act. Nigeria, the continent's giant, spends only 4% of its budget on health. Burkina Faso, under pressure from all sides, spends nearly 9%. In Nigeria, rural clinics often have no power or water. In Burkina Faso, solar-powered clinics are becoming the norm. The difference is leadership. Gates didn't say Nigeria should copy Burkina Faso, but the message was clear. Listen to your people, trust local talent, invest in your own future. Burkina Faso has shown that even under tough conditions, real change is possible. This story isn't about perfection. Burkina Faso still faces big challenges. But it's about progress, about belief, about a nation standing tall and saying, "We will take care of our people." Captain Ibrahim Traoré isn't just a reformer. He's proof that real leadership, visionary, fearless, and people-centered, can change everything. His government is showing Africa and the world that destiny isn't decided by history or wealth. It's shaped by courage and will. As Burkina Faso, Mali, and Niger walk boldly into a new era of healthcare built on dignity and sovereignty, the rest of Africa must decide. Will you join them? Will you rise? Thank you for watching. If this story moved you, don't forget to like, comment, and subscribe. This journey is just beginning, and Voice of Africa will be here to follow every step.